Welcome to this conversation that I am very excited to have between myself and Sara Kerrick. Before I begin, I want to acknowledge where I'm speaking to you from today, the unceded ancestral territory of the Husaanich and Coast Salish people of Saanich in British Columbia, Canada. And welcome to this conversation, Sara, from where you are this morning.
And I'm in Puyallup, Washington at Mary Bridge Children's Hospital. Also part of ceded territory that I'm not as knowledgeable as you, Kim, but I also want to acknowledge that.
Thank you. I asked you just before we came on this morning how many years we've known each other. And as I just turned 60 this year, I'm reminiscing a lot about the people in my life who have been so influential to me, and you are one of them. And it's been 20 years of collaboration, knowing each other, and I'm very honored to have you both as my friend and my colleague.
Oh, thank you so much. I mean, I would certainly say the same. You know, I always tell people that I'm a Kim Barthel groupie. I've done so many of your courses, but more importantly, I think it's our friendship that we have and our respect for what each of us bring to the table. The many meals we've shared over the years and stuff with Brett and Juanita and various people, but it's just been a blessing in my life to have you and Bob be part of it. So thank you.
Well, today, what we want to talk about is movement and neurodevelopmental treatment. And so let's come into, first of all, you are a physical therapist. And talk a little bit about that history of yours in working with children with diverse needs.
So I've been a therapist. I'm on my 40th year. So I graduated with my bachelor's in PT in 83. And so here I am in 23, nearing the end of my career, in all honesty, because I can't do it for another 40 years probably. But regardless, and I was very fortunate in school to have an instructor who had been trained by the BOBAS twice, had also done PNF, had also done RUD and that. And so at that time in 83, you know, we were still very much enmeshed in the maturation model and that. Shortly thereafter, the more dynamic systems model came out, which was a significant change in how we looked at how do we organize movement for ourselves and how does that apply to the people we work with. I've always thought I'd work with pediatrics, and I have always been involved in pediatrics for my whole career. I moved up to Puyallup, Washington, and have worked at the Children's Therapy Unit now I'm on my 35th year. Because my husband actually came up here to go to OT school, and then we just stuck. And so we've been here. And I had actually taken my certification course for NDT from March Adams at University of Puget Sound in 87. So my first introduction was right about the time that the neurosciences were changing and all of that. But I think the gift that my NDT training and the NDT training that I've had from various instructors for my whole career has been really that where do you put your hands and how do you talk with your hands? And because we're going to touch our clients regardless. And I've been thinking about this quite a bit because, you know, there's been this disconnect, I think, between academia and whether or not we should do NDT, because it's a practice model that really has come from the ground up. It's been more therapist driven and clinician driven, and there's enough nuances to neuro rehab in general that it's hard to research. Because there's so many variables, there's such a diverse population, we have a multitude of ages, and it just depends depends on what the family wants, what the child wants, what the client wants, what I'm going to do. But what NDT has taught me is if I'm going to direct movement, if I'm going to touch a child, if I'm going to guide a parent on how to touch a child, I'm going to do it with great intent based on my knowledge of what typical expected movement is and neuroscience. And so I think that's what NDT has brought to me. I've been very fortunate to done a fair amount of teaching. Now, I'm not a coordinated instructor with the Neuro-Developmental Treatment Association, but I've been teaching an intro course to NDT since the 90s. and then the next level, the intermediate course, which we are getting ready to offer this spring. But with Brett Nyrider, my coworker, and various other people I've worked with, and then I've helped with facilitating 8-week courses and advanced courses and baby courses, the upper extremity course that you'll be doing. So yeah, I don't know. Did I answer your question? Kind of.
You did, and I'm eager to add in and dialogue around a few things that you have said. There may be some people in our listening audience here who actually don't know what neurodevelopmental treatment is, who may not understand it in the way that you and I live it. Yeah. And before we go there, maybe I'll just say a wee bit about my history.
Yeah.
And what it is that brought me to NDT. When I'm just a year ahead of you, I graduated in 1984, so I'm at year 39, and as an occupational therapist. And when I was in my first job, which was in Winnipeg, in Canada, I worked at the Winnipeg Children's Hospital. And there was a clinician in our department. Our OT physical therapy department was in the basement, which was classic of 1985.
That's where mine was for children's therapy unit.
Yeah, in the basement. And this particular clinician was NDT trained. And I remember being, I think I was 22, sitting on the mat watching her. And I was in love immediately. And I remember thinking 2 thoughts. I want to know how to do that right now, in this minute. And I don't know if I'll ever be able to do that. Those 2 thoughts happened almost between breaths.
Yeah.
And what I was seeing in front of my eyes was functional change. Functional change in ease of movement, functional change in activity, functional change in, I wouldn't have known to put these words to it then, arousal and affect, functional change in relationship. All of these things seem to be happening in front of my eyes, and I wanted it. I wanted to have those skills. And I remember taking my eyes and zooming in. Her name was Debbie Gunther Hansen. I'm giving you a shout out, Debbie, on her hands. And, she had these beautiful, long fingers. And it looked like she was playing the piano on the child's body with different fingers asking different body parts to do different things. And it looked so natural and easy and effortless, and I knew it wasn't. So that began this wow motivation. I originally was deeply influenced by Dr. Jean Ayres. So right out of university, I did an internship at the Ayres Clinic and had gone back a couple times for training right out of university. And around the same time as watching Debbie on the mat, I remember Dr. Ayres saying to me one day, Kim, and I don't know why, me in front of all, with all of these different people, Kim, you need to go learning about the body. And I was like, okay, what does that mean? She said, I think you need NDT, Neuro-Developmental Treatment. And because Dr. Ayres said it, it was like, okay, I'm going to do that. And I didn't even understand what she was thinking, was that she was saying to me, there is such a strong connection between the systems, which, when you're in the beginning of this learning, you don't know how to integrate all this information with much ease. So that began the journey of neurodevelopmental treatment. I took my 8-week training. I've taken the 8-week course myself 3 times and am now a neurodevelopmental treatment instructor, OT instructor, both general and advanced after all these years, and have taught 11 8-week courses. And this particular way of knowing and being is not just about handling.
No.
And that's what I've realized is misunderstood.
Yeah.
In the bigger picture of how people think that what NDT is offering is these treatment sessions of interface between the therapist and the child. It's actually about all the things that are going on in the mind behind the scenes that have everything to do with kinesiology, anatomy, biomechanics, motor science, systems theory. It's all there in a holistic package that gives us our clinical reasoning. And so I think if I had to want to impart to anyone who's not familiar with this term neurodevelopmental treatment, is to understand it in a broader level is so much more than what you see. And to realize there's tremendous amounts of knowledge informing the choices that you're making in your treatment.
True. I mean, it's that critical analysis that you're constantly doing that it's combining a lot of systems. I mean, it really is that, okay, I know that this is their base of support related to their center of mass, and I'm going to, direct a weight shift. But the weight shift is related to this movement.
Right.
And so what does that look like? And so in the back of my mind, it's that critical thinking that I've done and learned to what does the direction of the weight shift look like? What do I want my hands to tell them if I have my hands on them? Or how do I set up my environment to get that? So I'm cluing into the vestibular or the visual system, or, I'm directing play, the salience piece, to it in such a way that I'm getting the results that I want, and imparting that information to a family member or to the client so they own the process, that kind of knowledge of performance, how'd that feel for you, and then repeating it. So it is a constant dialogue that I've learned to have inside my head, and with my clients and family, that help them to become more efficient. And I think the word ease of movement is it relates to function, and function as it relates to participation.
Wow. I think when I listen to you say what you've just said, it's reminding me of an experience that I had treating in clients from an orthopedic perspective, adults with pain. and I have some very dear friends who are chiropractors,
Mhm.
and talking about debating, is it enough to just have alignment? And the answer is no,
No, yeah.
right? The answer is absolutely no. And one of the things that the NDT lens gave me to my already existing occupational therapy thinking was, how does this new alignment, new activation, new sensory experience, embodied sensory experience of a movement become embodied in everyday activity?
Mhm.
And that's the only way it sticks. I know myself, I go for body work once a week and then I end up with my neck in this position anyway. Unless we actually functionally change the way that we move qualitatively, it doesn't change or it doesn't
Right.
hold.
Yeah, it doesn't hold. And recognizing that what our normal is, or what their normal is I have to, it is a sensory motor experience that starts with regulation.
Yeah.
If they're not regulated, if we aren't regulated, I can't learn. And motor learning is learning. And so the whole idea of hiding the work in play, or being more functionally related to a goal, it all starts with, that concept of salience. It has to matter. And salience starts with, I'm in a state to learn.
Mm. What do you think when we are faced with questions? And sometimes they're not questions, they're actually negative comments about our work. And it can feel personal. There are so many times when I work in my own being to separate from that personalization, to think and listen about, what else would I do?
I know, that's exactly my question is, I want to know what other people's treatments look like if they're not doing more of an
Right.
NDT type basis, because it is such a part of my being. And I'm certainly cognizant of the need for research and neuro rehab, and really trying to be part of that process as we move forward. But I feel like there's a disconnect where they really, like, I don't know what they do.
And I'd love to learn. I like to learn everything.
Yeah, 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 yeah.
So it's not a matter, when I seek into my soul, is it my, hardcore conviction to this way of being that interrupts my openness, and I can genuinely say no.
Yeah, yeah, yeah.
And the challenge that I have is that I don't, to me, the idea of practicing function on an existing structure of systems that can't do it through task analysis and verbal cueing, it doesn't seem to me to feel like a way that I can get my head around. What do you think about it?
Well, and I kind of back up and I look at, so it's always recognizing alignment, um, and where I am in the process for motor learning. So, example is, we all learn to walk, and we walk in a high guard with an increased forward pitch because, yeah, and that is typical. And as I gain greater control in my trunk, I can disassociate my arms from being part of my postural system, and now my arms can be used for something else. My core is more actively involved. So early learning, when you look at the complexity of the task, you have to give some things up. You can't have the perfect picture the first time. And so recognizing that, I'm willing to set up the best alignment that, using my equipment, using my orthotics or whatever to get a more efficient alignment, but also recognize that I want to also knowing with early learning that I'm going to tweak it as I go.
Mm.
And
And
that,
what you're talking about is the natural biomechanical
yes.
compensations that any body will do when one part of the whole can't be accessed in a way that is in its design.
Right. Right. But it doesn't mean that we throw out that
Right.
design for the long haul. Because you and I have been practicing long enough that we've seen older people with disability who've had chronic disability for a long time. So I had an instructor in PT school who taught me, a very simple principle. One is normal stress on normal joints. You kind of are sustaining the joint. Abnormal stress on a normal joint eventually becomes abnormal stress on an abnormal joint. Abnormal joint equates pain and inefficiency.
Yeah.
And so knowing that, I'm always trying to preserve joint integrity or body structure function integrity, knowing the long haul of what happens with people with chronic disabilities and typical people.
And I was going to say,
Yeah,
all of us.
I am not out of that picture, of we get more joint, you get more breakdown of systems.
Yes.
And then it becomes a different problem that I'm also dealing with.
Right.
And so there's, I think, some integrity to the body that I want to respect, and really look for the long haul.
Mm.
I also think that what do I need my kids to do when they're young adults? And so I'm really looking at that 3-year-old who's learning early stepping and they're doing all this stuff and yes, we're enhancing their participation. How do I continue that over time? And what do I think they'll need when they're 18 versus when they're 3?
One of the interesting influences in my life was Reggie Bain.
Mm-hmm.
And many of you may not even know that name. And yet she was so important in the world of disability. So Reggie was an OT, NDT instructor who also had post-polio and was pretty much a paraplegic and treated children and adults with her upper body. And one thing that she said to me that stuck with me is each of our bodies is our responsibility for our lifespan. That this is not about cure, gosh forbid. None of what we are doing in this process of understanding movement and treating kids is about curing cerebral palsy or curing the motor system of Down syndrome. And I've heard people say those words in my history. It's about finding ways to empower beings to be responsible for their own bodies. And in fact, I had a client who I treated from the NICU till he was about 17. So that's a long time. He's now a lawyer and he has athetosis as an aspect of his challenges in movement. And I said to him one time, what do you remember about coming for therapy 3 times a week for 15, 16 years of your life? And he thought for a minute and he said the most powerful thing. He said, I don't remember much about what we did. And he said, I remember how I felt about what we did. That I always left therapy feeling possible, feeling hopeful. And he said, now that I'm a lawyer, do you think I would waste 1 ounce of my energy dressing myself? I need my energy for the courtroom, he said. And I have somebody who is a personal assistant that I pay who helps me. And I know how to advocate for myself and explain to them what I need to do, how I need to sit. Our clients remember us, and they learn these principles from us as a part of their being. Many of our clients know how to talk about their bodies in ways that 5-year-olds and 6-year-olds don't have to.
Right, exactly. Exactly. And we kind of teach them that too, because people are going to ask them questions. And so I want them to feel good about themselves. I want them to feel positive about themselves, and I want them to be in their community. So yeah. So I think, to kind of go back to the NDT, I think the NDT has just empowered me, like you say, in helping create possibilities. And 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 also, as I've learned more about neurosciences, motor control, all the theories that are coming, that you and I have both spent many years learning, integrating into what we do. Also, that what are best practices to help that carry over into the home environment.
Yes.
Still keeping into mind that my movement analysis, my critical thinking is really important, and it has value to this picture.
One last thing I want to remember to mention here is that you are also the you are current past president of the Neuro-Developmental Treatment Association Board of Directors. And the knowing of this process has been a big commitment for you in your life. And in that, I wanted to talk about some upcoming workshops.
Yes.
And one that we are collaborating on together is the Advanced Upper Extremity Course certification process through the Neuro-Developmental Treatment Association. Now, historically, this advanced upper extremity process has been designed in its certification protocol to be all in person over the course of 5 days. During the pandemic, we changed that up into a hybrid to make it into 2 parts: theory online and handling and practicums with mentorship in person. The part 1 was delivered live in 2022, of the fall of 2022, and continues to be accessible, will be accessible across time. It is true that this part 1 is the official curriculum of the Advanced Upper Extremity Certification process. However, you still might choose to take it and not want to be certified. And what exists in that part 1 is a real deep dive into kinesiology, into the motor system of the upper extremity trunk, hand, especially the hand. The hand was wow. And how that affects or implicates in what we do in our treatments, irrespective of the population that we're serving, from children with significant motor disorders to very mild. So that part 1 is still existing, available, purchased through Marybridge, and accessible on Relationship Matters Thinkific platform. Part 2 is in person and requires part 1 in order to attend part 2. And this, to me, is where rubber hits the road. where you get a chance to put your hands on kids as an already existing neurodevelopmental treatment certified clinician, where you have a greater depth of practice and problem solving in a very zoom lens way on the upper extremity. And together, we are collaborating in the creation of part 2 to be hosted at Marybridge in Puyallup, Washington. How did I do with that description?
Good. Great. 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 And I also, to go connect into that, we teach a variety of courses with an NDT emphasis here at Marybridge Children's Therapy. And one of the courses that we're offering is pre-certification. So Brett Nyrider, who we like to call the movement whisperer, because he has the lightest hands known to mankind. He and I will be doing, we've done an introduction to NDT, and our next level is a more intermediate, but still pre-certification course that we are doing as well. That's a 4-day course that will have lots of movement exploration for the participants, but also some practicum piece to be able to sort of apply some of your knowledge that you have as well. And the advanced upper extremity course also has a practicum piece so that you're adding that into it as well. It's an opportunity to practice what you're learning and to go home with hands that are talking a little bit better. Mind that's going crazy.
Nicely said. For those who are interested in these offerings, where can they find how to register?
So go to multicare.org and look under CTU classes is where you'll see the listing for the advanced upper extremity course, part 1 and part 2 that you offer, as well as the NDT courses that Brett and I will be doing as well. So.
Brilliant. You can also find this information on kimbarthel.ca. Sara, thank you for the conversation today on movement, and what matters to us is helping people to become inspired and excited about their learning and how to support kids.
Thank you. I so appreciate it.